So tell me about practicing in family medicine, and how long have you been practicing, and what is it like running a family practice?
I've been in family practice for approximately 26 years. I see patients from, initially I saw patients from birth to death. I took care of families, their children, the parents, the grandparents. It's a unique experience, probably one of the only fields in medicine that you get a chance to develop a relationship, sometimes personal as well as medically, with a person, with a patient. It's a great experience. You build a lot of bonds, and it's interesting. It's kind of funny because you can see how patients, the mother and the father and the son, how they talk, their expressions. I often say to them, you act just like your mom, or you talk just like your father, or your smile is just like your grandmother, and it brings people closer together, and it helps me to develop a bond with the patient that when they're asking me a question, medical question, I can honestly help them, guide them to a decision that they have to make.
And what are your roles in this practice, you, Michele, and you, Dr. Lanza, specifically?
My role is to facilitate care. Patient comes to me with a complaint. I make the diagnosis. I send them for tests. I direct them as to how we can get them better, whether it's a simple thing like a cold, an upper respiratory tract infection, a urinary tract infection, to something serious, a cancer, heart disease, diabetes. My sister, who I've practiced with for 15 years, this is a great experience. I know many people can practice with their sister or their wife or their brother, but it's been a great experience because my sister, whose expertise is diabetic education, I can send them. I say, look, I got a great person here that can help you, for instance, for diabetes or hypertension, that can help you with a diet, exercise program. So we work as a team. Not everybody has that, and family practice needs more of that, because in the population as we see today, we have a growing concern with diabetes and hypertension, and we need more family practitioners and educators such as Michele to guide the patient to get them more healthy.
And what is your role as a certified nurse practitioner?
So my role is, as an adult nurse practitioner, I'm an independent provider in the practice, so I'm a first point of contact for a patient. So I basically treat all acutes and chronic illnesses, do follow-ups, order tests, diagnose, refer, prescribe medicines. I have a little additional opportunity because I'm given a bit more time with my patients, that I can delve into an educational piece if I want to. So I've had some experience in specialty practices like psychiatry, and I've been doing a lot of work with weight loss, which is primarily the focus for diabetes also. So I've been able to incorporate that into my practice by having some appointments that are just dedicated to that. So a person will come in for 40 minutes and I work on their diabetes and their weight loss, and it's a lot of fun. You might not think so, but people do the most amazing things when they're inspired. So because I have that little bit of extra time, I can do both the acute care, somebody comes in with chest pain, a sore throat, but I can also have separate appointments where I can focus on the education.
And what is it like working with each other? I know that you said that you had a good experience, but does it make it difficult or harder sometimes? Harder or easier?
Never makes it harder. It always makes it easier. For moral support, on a medical basis, she asks me questions, I ask her questions, we formulate a plan for a patient. She's the next office to me. so I can run in and out. I don't know what I'd do without her. We've been together for so long.
It's really fun. He is a great physician. He is so inspiring and so open-minded, welcoming to nurse practitioners, always a teacher, builds great relationships with patients, and I do the same thing. We share a lot of patients, and as part of, when you were talking about family practice, and Dr. Lanza was talking about that, treating these families that we share, and I've been doing this for 15 years, we go to birthday parties and weddings and funerals on occasion, because we've become part of their family. So we've seen a lot of interesting things, and the relationship that we've established with our patients it's really special. It's great. It's really great.
Besides building relationships, what should your patients expect from a family practice that they might not get somewhere else in internal medicine?
I think with patients, what I expect if I'm going to a physician, and I try to do to others as I would have done unto me, so to speak, is you want the doctor to be honest with you. You want the doctor to listen to you. The hardest part is when you go to the office and patients come to me and say, my previous doctor didn't listen to me. I gave him a couple symptoms, he knew what he was doing, and he diagnosed, and that was it. You have to listen to the patient. If you listen to the patient, they will give you the diagnosis. They will help you help them. And as a physician with 26 years of experience, I have I have other doctors that I can call on, that I know how to refer, that I order the test, and you get a prompt call back. If you call the doctor should be able to call you back within a reasonable time, answer your questions, be there for you.
I think really it's important to stay engaged with the patient and meet them wherever they are and with whatever their need is. So if somebody comes in for a sore throat, for instance, but they're very distressed or they're tearful, sometimes you just have to sit down and shift gears with that patient, because they're there for something else. So I think it's focusing on helping patients get what they need, being flexible when they come in the office. Also, I try to stay engaged with the patient. I spend time, eye contact with the patient. Is there anything else I can do for you today? Do you have any questions? What do you need explained? So that they feel like they have that relationship and the education that they need. Mm-hmm. That's an important part of family practice and general medicine. They want that continuity, they want information, and also a lot of them, most of them want to be empowered. They want to know how to stay well. Mm-hmm. People don't not attend to their health because they don't want to. It's a lot of times it's a lack of information. So being able to really empower the patient as part of our practice to take care of themselves.
And out of the 26 years you've been in practice, what would you say is the most unique characteristic or quality that you bring that patients want to come to you? Like, why family practice? What makes you different?
Well, I think why patients come to me, in 26 years of practice, this is my second practice. I was in solo practice for a number of years, and then I became a employee with a larger institution, and I moved from Medford to Moorestown. And what was great was, and when I joined this, my new employer was not sure if I would be able to take patients with me. Probably 80% of my patients came to this practice and left my other practice. So, and the reason, and I asked them, why do you come? Why did you come? You live so far away. Because you listen to me, because you care, and you've been there when I've needed you. So I think that's that's what I bring. That's what a family practitioner should bring to the table, and I think we've done that, my sister and I. And most practitioners, family practitioners, for the most part, they do that as well. That's what's special for family practice. That we build those bonds. People need to be empowered. They want that one-on-one conversation. It's not, here's your meds and go home. It's how you doing? Do you need anything else? What can I do for you? How can I help you? That's what makes family practice special.
So Dr. Lanza has the most amazing relationship with his patients. It's really something to observe. It really is. Very inspiring. And I think,
That's the other reason why it's good to have a sister for family practice, because she always empowers me.
Well, I mean, he's great to work with, and I've learned so much from him. And I think because our styles are similar, I guess because we're family members, we're related, I think, probably my strongest suit is that I really care about my patients. I care how they are doing, and that goes a long way. Just caring and having good intentions and being all in with a patient. A lot of times when my patients leave my office, before they walk out the door, I say, we're in this together.
One of my professors when I was in med school internship said one of the most important things you can do when you're with the patient is you touch the patient. Just having your hand on the patient helps the healing process.
One more question. If people want more information, where can they go? Do you guys have a website or an email or something they could find out more information about?
If you go on, we're with Lourdes Medical Associates. If you go on the Lourdes website, there is the family practitioner section, and you can contact us through that.
Okay, great. Thank you guys for being with me today.
Thanks.
Thanks.
It's been our pleasure.